Welcome to the Researched RN podcast. I'm your host, Steven Kuzmenko. In this podcast, I discuss new and interesting peer-reviewed research articles from various nursing researchers and other professional publications. In this 9th episode, I'll talk about an article published in the March 2023 edition of the International Journal of Nursing Sciences titled Organizational Culture and Roles in Promoting Nurse Specialty Certifications, a Qualitative Study in the United States. It's authored by Wei and colleagues. I chose this article because very soon, on March 19th, it's Certified Nurses Day, and that's a day that I hope all of you guys are celebrating your certified nurses. And one thing I didn't know before I get into the article was that March 19th was picked because it was the birthday of a major pioneer in nursing credentialing or nursing certification. Margaretta Madden Stiles, who was a pioneer, as I mentioned, in certification, had a very long career primarily in nursing academia, but that is her birthday, and that is why that day is selected. So I didn't know that prior to reading and learning about this, but I hope that you do celebrate this day. So let's get into it. A quick overview summary. This is a qualitative study that explores how organizational culture and leadership impacts nurses' decisions to pursue specialty certifications in the United States. And despite proven benefits of certification on patient quality care, certification rates remain low. So this study aims to better understand how nurses' perceptions of the facilitators and barriers in promoting nurses' desire and ability to obtain specialty certifications, which also includes advanced nursing practice roles such as nurse practitioner or nurse midwife. So this is a great article for really anyone. If you are a supervisor, if you're a nurse manager for a single unit, if you are the director of a certain department, if you're a chief nurse. As I summarize this article, you will see that it's clear that organizational culture and leadership has a huge impact on whether nurses feel like certification is important. And so let's get into the introduction. We know that specialty certifications validates proficiency and knowledge in whatever field you work in, whether it's critical care, oncology, perioperative nursing, emergency nursing. When you get certified, it's an outward expression, a professional expression that you are dedicated to that specialty and you have advanced knowledge in that specialty. It typically requires a test. There might be a minimum passing score. And the other thing that it demonstrates is that you are a lifelong learner and that you're dedicated to your own professional development. We know that nursing is a profession of lifelong learning. It's required. Nursing will never be stagnant. Healthcare will never be stagnant. The way that we treat patients in their conditions will never be stagnant. And so certification is your way of saying, hey, I'm going above and beyond, and I'm going to demonstrate that and take this test. There is also some research that links certification rates to the quality that patients receive. This has been demonstrated in patient mortality rates, fall rates, and hospital-acquired infection rates. So there is a lot more research needed in that, and the reason is that research is really hard to do because how many nurses work in your hospital? How do you separate out the care that certified nurses give and non-certified nurses give? So in general, those studies looked at magnet hospitals, and so with magnet hospitals, one of the requirements to be magnet is you have to have structural support for certification. And so that's just where some of the research has occurred. In those magnet hospitals, they tend to have better nursing sensitive indicators and less complications. And so we kind of extrapolate that into saying that they have better patient care quality. Me personally, I think it's fun. I'm one of those nurses that I have three nursing certifications above and beyond my nursing license as well as my education. So I think it is important for us to do. But despite all of that, only about 30% of nurses in the country are certified. It's somewhere in the 30th percentile. The citation that they provide in this article, it was about 39% of the nurses that were certified in that sample. It's a different article, but if you'd like to read that, you can. It's linked in the references. So let's get into the methods and figure out what are the organizational factors, the culture that is helpful in getting more nurses certified. And so the way that these researchers studied this was they performed a qualitative study. What happened was in May of 2022 to September of 2022, there was a national survey of U.S. nurses that was more quantitative about, certification plans and demographics and whether or not they were certified, education, years of experience. After that big survey, nurses were asked whether they wanted to be contacted for a follow-up communication or a follow-up interview. So I've never been one of those lucky people to actually be contacted after I've put my email on a few of those. But from that sample that said, yes, I'll be contacted for further communication or follow-up, there was purposive sample used to find a wide variety of nurses. And this included nurses that were certified and were not certified because they wanted to explore their perceptions, and nurses that are not certified, that is just equally as important because we want to figure out what is blocking them. So the facilitators and the barriers. The inclusion criteria was that they were an RN, they were certified or not, which is literally every RN, but they were more importantly willing to share their experience and their perception. And the exclusion criteria was just that they were not willing to share their experience or their perception. So there were demographics collected and virtual face-to-face interviews. I'm not exactly sure how many people were on this Zoom type call, this virtual interview. I don't know if it was one-to-one with a researcher, but they ended up getting 20 nurses interviewed. And there were specific questions that they asked them in these interviews. There was a lot of questions. I really encourage you to read the article if you want to read all the questions, but some of them were, could you please describe your role as a nurse on this unit? Another one was, how can nurses be role models for one another, especially new graduate nurses? And then maybe another one here was, what helps you become certified? And there was many more questions that they asked. And so let's get into the results and the key findings. As I mentioned, there were 20 nurses that were interviewed and 5 themes emerged regarding the strategies that organizations can use to encourage certifications. So the first one was sharing resources. This can look like providing study materials. One of the things that nurses said was after a nurse got certified, they saved their materials, and if they knew that they could have those, it's quick and easy and it's all done. The example they used was, don't reinvent the wheel. Someone else already made the wheel, just make it work for your automobile or your car. So that was one of the things in regards to sharing resources. Other things were organizing study group sessions. So if nurses on a particular unit with a particular subspecialty all needed to know the same thing to pass the test, well, then why don't they all just get together and they study for the exam? And so I did this a lot in nursing school. I had group study sessions, and some maybe have feelings about that, whether or not that's productive or not, and if you're actually talking about the material that you're there to talk about. But nonetheless, being in a group with the same shared mission and the same shared values was a facilitator. Additionally, with sharing resources, just increasing awareness of available resources was a facilitator, especially when that came from their direct leader. As I'll mention later, that has to do more with the role modeling. But if that direct leader said, hey, here is this certification course that's coming up, or here is this book, or we have a library of older books and that are mostly aligned still with the test plan, whatever it may be, any sharing of resources was a big facilitator for the nurses in these interviews. The second theme was a culture of ownership and a sense of belonging. So this had to do with the need that a culture be created where certification is valued and actually seen as an achievement. So this could have meant that you're gonna have more improved confidence, and you're gonna feel like a subject matter expert. And this unit, we provide that advanced nursing service, that advanced nursing practice to these patients. And so getting certified is going to help you feel like you are really part of this specialized unit. Or even if you're not specialized unit, just giving that care and owning that as part of your practice was a big facilitator. So if you are a leader, you want to stress that, hey, getting certified is awesome. I value it as a leader, and it is hard work. And additionally, I mentioned that nursing is a career of lifelong learning, lifelong professional development, and being certified is a way of owning that, owning your profession as a professional, but just stressing that how important it is to get certified was a big facilitator, especially if it came from their direct leader. The third theme was mentorship and role modeling. This had to do with how encouraging certified nurses and leaders to mentor others and promote professional growth can be a facilitator for getting more nurses certified. So nurses that are more experienced or have that certification, they role model and say, wow, like, look, that their assignment, they're taking care of a really difficult patient, but they're doing very well, and they know so much about their patient, and it's very clear, or they're frequently being that resource that newer nurses are going to ask, and they can demonstrate that they have this advanced knowledge, and they're able to verbalize it so well. And the way they talk to the doctor or the nurse practitioner in whatever field or setting that you're in, they do that really well. And so other nurses can see that, and they role model. They themselves are certified. Leaders that are certified themselves. So, this theme of, if you're going to talk the talk, you got to walk the walk. So if you're a leader and you're not certified and you want more certified nurses, one of the easiest ways for you to do that is to get certified yourself. Nurses that in this study, they felt like, well, if they're asking me to do something that they themselves haven't done, then I'm not going to view that as important. I'm not going to really value or prioritize that in my professional career. The other thing too is, if it's possible that you can have mentorship on your unit, and those mentors are champions and cheerleaders for certification, that is another facilitator that emerged from these interviews. The fourth theme, recognition, recognizing nurses' efforts and accomplishments. This can mean celebrating certified nurses with plaques and badges, and really financial incentives too. This could also mean a lunch or being at a huddle and really pointing out that, hey, I really want to acknowledge that this person is certified. And so, hint, hint, March 19th is coming up. If you want a really great day to capitalize on the recognition of your nurses, make sure you do that on March 19th, and share this episode with your other nurse leaders so they can understand why this is so important. Nurses felt like that outward recognition, really, they helped them feel great. It improved their self-esteem and showed other people that they are that subject matter expert that they really wanted to be. And so that's an extrinsic motivator, like, I want to be recognized, but that is something that nurses valued. As I'll talk later on in the podcast, some nurses valued it differently. There were more intrinsic motivators, like just having that knowledge, but that extrinsic motivation is something that we should tap into and say, hey, if you get certified, I'm going to mention you at the beginning of this staff meeting or in huddle, or I'm going to have a lunch for you. Now, of course, you have to consider the costs of all these recognitions, but just having a cheap frame and asking them for that printed certificate saying that they're certified, go to the dollar store, buy a frame, mount it. It does not have to be expensive, but of course it can be an extravagant gala or an event or a dinner that you invite them to. But, that's something that obviously we have to consider as leaders in healthcare. But nonetheless, make sure that you are recognizing their effort that they put into study, that they put into show up to the test site, and their accomplishment in passing it. The fifth and final theme was cultivating a sense of meaning, purpose, and support. So this has to do with organizations' need to emphasize the long-term benefit of certification that can provide, benefits in their career advancement, but also their professional fulfillment. One of the things that's really, really important is that nurse leaders need to be able to clearly articulate what is the meaning and what is the purpose of getting certified, because there are going to be some nurses that are like, I don't think it's that important. I don't think it's going to help me do my job better. I don't get paid anymore. So your organization is going to have different incentives for them to get certified, but some nurses just may not see that value. So you just have to be able to share that with them and explain to them why it's important. Of course, as I mentioned, through role modeling is one of the big things. But this could be certain incentives in the workplace, if you have them or not, like the clinical ladder, or maybe it could be a requirement that in order to be charge nurse, you have to get certified. And so that's part of their professional growth and their advancement in the field of nursing. And in my experience too, I have personally interacted with very, very experienced nurses that know a tremendous amount and are phenomenal nurses, and they had decades of experience and they just didn't see the value. Maybe they were at the top of their earning. They couldn't get more. And so there's no financial incentive. It's going to take time to study. I have to pay for the exam. I don't really see the need to do that. So of course, it's in any point in your career, it's still hugely beneficial to get certified, but some nurses may not see it better than others. So, of course, considering all the other themes that I just mentioned with sharing resources and creating a culture of ownership and a sense of belonging and role modeling and recognition, hopefully that all of those things are done in a way that cultivates that sense of meaning and purpose in getting certified. And then lastly, with support, organizational support, I kind of mentioned that, with needing it to be on the clinical ladder. If you want to make more or you want to get a bonus, sometimes it's their hourly wage that's increased if they're certified. Other times it's like their total annual income that a percentage increase is enacted. Other times maybe it could just be a one lump sum. So your organization is going to do it differently, but if you don't already have that in place, then I really encourage you to advocate to your chief nurse, to your director, whoever's in charge, whoever has that authority, because that is going to capture a lot of people, especially those that are more motivated by extrinsic factors in getting certified. So those were the 5 themes. I'll finish up with the conclusion and limitations as well as the implications. So the conclusions, we now see that it's clear that organizational factors and leadership has an influence over nurses' willingness to get certified. And leadership, especially that direct leadership, plays a critical role in the culture that's needed to support certification. And this is not just that local leadership, but from the top to bottom. If you are a chief nurse, if you are a director, you should be promoting and cheerleading certification. If you are a nurse manager, if you're a supervisor, if you are a prominent preceptor or an informal leader, maybe you're the chair of the unit-based council or professional governance council. So it doesn't have to necessarily be a formal leader, but the leadership in general, people see that. And if those leaders value certification and they have it themselves, then we see through this study that the nurses are going to value it more. This could be as simple as, if you're a leader, just going to a local review course and sharing it. You can invite some nurses to come with you. If you're the nurse manager, if you're on LinkedIn, take a picture of it and put it online. Like, I attend this local review course, stuff like that. People notice, and it creates this sense of like, wow, my leader who I look up to, who I value their opinion about me, they think this is important, and they've told me that I'm going to be a better nurse if I do this. So we can see that that's huge, and that's really influential in nurses' willingness to get certified. You should also share the resources and promote the materials, the study materials or resources. If it's a library, if it's a review course that's just down the road, maybe your nurses don't know about it. So just sharing that as early as possible, like ideally in just orientation. I would just say, by the way, we have, every year we have a review course and a bunch of us get together and do it. Or every year we attend the annual conference for this subspecialty. And if you go early, if you're able to pay for that with the hotels and all that, but if you go a couple days early, there's a review course. And so a couple of us will go together. There's that camaraderie and that shared experience that they notice that. Nurses will notice that. And they need to see the value in getting certified. So in this study, the nurses that attributed more meaning and purpose to getting certified more positively saw the work needed to get certified. So it's almost like the work that's needed to get certified, to pay for the test, the hours put into study. Of course, it seems pretty obvious, but it's a prerequisite to already have a positive view on what it means to be certified if you're going to put all that time and money into doing it. So really try to promote certification and the value of getting certified and support it in the workplace. This could be via financial incentives, hourly wage increases, clinical ladder increases. So of course you have to consider that at your workplace, but based on the findings of this article, that was mentioned frequently that financial incentives are a facilitator. So if you're able to do that, that is great. And if you already have that, then just keep plugging that for your nurses. Some of the limitations of this article. So of course it's 20 nurses. There's a lot of nurses in the United States. And so that limits how it could be generalized. And in general, qualitative studies outside of having a small sample size are limited in their generalizability. Or what I mean by that is, does this pertain to nurses elsewhere? Does this pertain to other populations of nurses in the United States? Abroad, maybe international nurses. I do have nurses in the UK and in Canada that listen to this podcast. So I don't know if this information can be attributed to Canadian nurses or to British nurses. So of course, further research is always going to be helpful in uncovering these barriers and facilitators. And the other limitation is that about half of the participants had a graduate degree out of the 20, and then 7 out of the 20 actually had doctorate degrees. And so there was no focus on the educational influence on certification. That research has been done elsewhere by other researchers, and so I encourage you to look that up. But for the most part, that was not something that these researchers really investigated. But further insight is needed on whether or not education level impacts certification. So finishing up with the implications, I hope that you take this information and you put it into practice. You bring it to your workplace. I think this study was clear in that it helped us see that organizational culture and leadership support really does matter in nurses' perception in getting certified. So future research, if you're a researcher, if you support any evidence-based practice or PI projects, any interventions that support certification, either initial or continued renewals, anything like that, that's where a lot of research is needed, especially in the post-COVID era. I don't think I mentioned, but there was 80% of the nurses in this study were not impacted at all by the pandemic. They said, no, I didn't really think that it was more or less important during the pandemic, but there was 20% of the participants that the pandemic really brought down the value in certification. Maybe it wasn't a priority for whatever reason. And so now that in this post-COVID era, more research is needed into figuring out what interventions promote and maintain certification. And the other thing that's more research is needed on in general, like globally, not just in the US, but how certification rates lead to better patient care, the quality of care, and the improved operational outcomes. So those nursing sensitive indicators that we are graded on, I don't know if it's the same internationally, but in the US, we call those NSIs. So that's infections, falls, pressure injuries, just to name a few. But does being certified lead to less? We do need more research on that. In general, that is something that the authors mention in the conclusions of this article. So finishing up here, I really Finishing up here, I'd really encourage you to read this article, look at the examples of what nurses said in relation to the 5 domains. If you really want to further your understanding, it's really nice. They literally quoted what they said within each domain to come to that conclusion that this is, a major theme, but you get a lot more detailed insight just by reading those. So if you're able to get this article, read those, I was able to understand the themes a little bit more, and I hope that it helps you as well. That is a wrap on the 9th episode of the Researched RN podcast, your virtual journal club on the go. I am your host, Steven Kuzmenko. I'll have new episodes out at least monthly. Email me at researchedrnpodcast@gmail.com with any articles or topics that you'd like for me to discuss, or if you would like to be a guest on this podcast, email me if you just want to tag team with me summarizing a research article that is interesting to you. And if you enjoyed today's episode, please share this with a friend, especially knowing that Certified Nurses Day is coming up. And it would be a huge help if you gave me a positive rating wherever you listen to this podcast so that others can find me. Thanks for listening, and be sure to tune in to the next episode.